Hi everyone. I just wanted to blog about my endo experience that I had yesterday. One of many, but I just wanted to talk about yesterday. I was experiencing horrible pain. Today's October 18th, 2013, and I suffer from endometriosis. It's gotten more and more debilitating over the years. It's gotten more noticeable, and I've gotten way more symptoms over the years. I'm 27 years old, and I found yesterday's experience a little bit more eye-opening than all my other hospital experiences in the past. I started off experiencing UTI symptoms, bladder infection symptoms, urinary tract symptoms, constant frequency having to run to the bathroom. I had horrible pressure, burning, overall feeling of fatigue, nausea, almost flu-like symptoms. I went to a walk-in clinic and they just sort of dipsticked my urine, asked me a whole bunch of unnecessary questions, almost treated me as if I had a STD or I was making something up in my head. They did not know about endometriosis, or very little, and dipsticked my urine, told me that yes, there's protein which shows an infection, put me on 2 types of antibiotic, took my blood and my urine to send off to the lab, and I left. I went over the weekend, took the antibiotics, even though I knew that chances are could be a faulty reading and I'm taking antibiotics, then I have to deal with, of course, the yeast, the dreadful yeast of the antibiotics, but I took it anyways. Wasn't getting better, not really improving, and all in all having horrible pain on my right side, which I've always had. Sort of, that's my endo site pain. I get it on my lower right side. When it was managed, it was only 2 weeks before my period and then 2 weeks after my period. I would get these horrible pains on my side. Now I'm noticing it on an almost daily basis, whether it's moving furniture, bending in a wrong spot, going to pick up something. I'll always get that sharp, debilitating, tearing, stretching pain, and that went along with my bladder infection symptoms. Thought it was normal. It's not the only time I've ever had this. It was much worse at night. When I would lay on my right side, I would feel the need to go to the washroom right away and intense pain. And over the course of the weekend and the couple days after, the pain didn't go away. It was almost excruciatingly horrible, to the point where I was curled up in a ball with my trusty heating pad and couldn't move. So I decided I'm going to go to urgent care. I live in Canada, in Ontario, so I'm in Mississauga, Toronto area. So I go to the urgent care here in our lovely city, and I get taken in right away. They think it's my appendix, so they take me seriously. I tell them about my endometriosis. They kind of push that to the side. They don't really pay attention to me. The doctor comes in, pushes on my stomach. I'm in excruciating pain, screaming, and right away gives me an IV and shoots me full of morphine. And I'm flying high. I'm completely out of it. Don't know what's going on. But all I know is I still feel this intense contraction like pain on my right side. I'm screaming, I'm crying, and everyone's just looking at me. They take my blood, they take my urine. The doctor asks me if I may have gonorrhea, an STD, if I may be pregnant. Same old questions that they probably ask all of us women. And I tell them no. And I tell them about my endometriosis in more detail, that I've had ruptured cysts before. I've had pain in my right lower side before. I've had somewhat of the same type of pain in the past. And this feels even more so intense, even more painful. Everything comes back normal, which makes me look like I'm crazy. And the looks start, and the suspicion starts, and the nurses start acting just a little bit more reluctant to give me that pain medication. And I get sent to the lovely ultrasound technician who gives me a transvaginal ultrasound as well as on the top. And I'm clearly almost off the table. I mean, I must have jumped 10 feet in the sky. I was just in horrific pain. I almost felt like I was going to pass out. The pain got so intense. And she's just pushing and pushing on my side and pushing and pushing. And she's just fiddling around and doesn't even care that I'm screaming in pain. I mean, the people in the waiting room must have heard me. I was screaming at the top of my lungs. I couldn't even catch my breath. The pain was so bad. And she told me that my ovaries were too small and that she couldn't see them. That I had so much gas and I was backed up that she couldn't do anything, couldn't see anything, and pretty much that they were going to just give up. And that's what I usually get. I've gone for so many countless ultrasounds, and not one technician can ever see my ovaries clear enough because of gas, because of bloating, because of stool, and they just give up. Well, that ultrasound has scarred me. That pain that I experienced has scarred me, and I just broke down. My nerves are so bad from dealing with this constant battle within myself that I just felt like giving up as well. Just washing my hands of it. But I can't. I need to keep going. I need to press on. I need to find answers. So they wheel me back in the room, and the doctor comes in and says, "Your ovaries look fine on the ultrasound." I said, "But doctor, the technician told me she couldn't see my ovaries, and we stopped the test." And he goes, "Oh yeah, that's right, that's true. You were so impacted and there was so much gas we couldn't find your ovaries, so I'm guessing it's a cyst there." Oh, okay. Because 5 minutes ago you were telling me that they looked fine, so I let it go because he has the power of giving me more drugs, so I wanted to be as nice as possible. And they just kept giving me morphine in my IV and wanted to do a CT scan, which he told me the radiation was so bad for me that every time I get a CT scan, it increases the risk of cancer. Well, he wanted to rule out appendicitis, so he says that the only way he could do that is through a CAT scan, and he wanted to call a gynecologist at Trillium, which is their connecting hospital, to see if she would see me and maybe admit me at the hospital. And he called and she said no, she wouldn't see me, that it's probably something surgical for just a surgeon and that it has nothing to do with gynecological issues. So, oh, and she also says we don't admit endometriosis patients. That's a good one. So, after that, I went for the CT scan very, very, very reluctantly went for the CT scan. And maybe the help of the morphine kind of gave me that extra courage I needed and said, well, to hell with it, I'm going to get the CT scan to see what's going on. Well, needless to say, we ruled out appendicitis and I was back to square one. In the meantime, my doctor had gone home because I'd been there for now, I think going on 10 hours. I was in that emergency room. And the doctor went home and I was seen by another doctor who came in and said that the CT scan showed everything was fine. Well, in fact, on the paper, it says they were unable to see my ovaries and they don't really know if everything was fine. But they wanted a quick fix as usual. And they wanted to get me to just go home. They didn't care. I'm just a patient. I'm just a paper. I'm just a number. And I could see that. I could see that as it was almost time for me to leave because they saw that there was nothing wrong with me, that the test results were coming back fine. They weren't listening to me and they weren't looking at me. I mean, the doctor came in, he didn't even come into the room fully and was ready to discharge me. The nurse, before I got my CT scan back, was already wanting to take my IV out and saying that I couldn't ask for any more medication for pain. It is so defeating to see in the doctors' and nurses' eyes that they've just given up when you're struggling so hard to make it through every day, feeling this horrible pain. And when your doctor comes in and spends 5 seconds looking at a paper rather than the patient, it crushes you. I almost felt like, am I faking? I questioned myself. Is the pain really this bad? How come it's not getting better? And I said, no, Sarah, you can't do this to yourself. You are in pain and you deserve answers. And he wrote me a prescription for Percocet, an anti-inflammatory drug, and see ya. I left. I think I left in more pain than I came. I haven't slept. I'm in excruciating pain still. And now I'm just left to question, is it all in my head? But then I remember that no, it's not, because I wake up and deal with this. I go to sleep and deal with this. That my endo rules my decisions, rules my life. It can't be in my head. This is a real disease affecting me, affecting everything that I do. And it's the doctor's stupidity and ignorance that makes me question myself and what I believe in. And it's wrong. It is wrong for them to take that power away from you. I won't go back to the urgent care anymore. If I'm in pain, I'll find other ways of dealing with it. I don't want to be put in that situation that I'm treated like a drug addict or a crazy person or a fake or weak. My pain tolerance is high. I live with this every day, but I still get up in the morning. I still put a smile on my face, and I still do what's expected of me every day. No excuse. I just want to be validated.